Many people learn about having diabetes at their doctor's office during an annual exam. And they're usually surprised when we tell them they have diabetes because they haven't had any symptoms or felt any differently. There are several ways to diagnose diabetes. One of them is the hemoglobin A1C test, which can tell you or suggest high levels of sugars for the prior 3 months. There is an increase in the incidence of diabetes in the US population. So the question that a lot of patients ask me is, did the weight gain cause diabetes, or will they gain weight because they have diabetes? Hi, I'm Dr. Naznin Jamal, and I'm a board-certified internal medicine physician who practices as a hospitalist. My goal is to empower you and your family members with basic education on diseases. So let's begin. What is the difference between overweight and obese? So you can't talk about diabetes without talking about weight. We use a calculation called the BMI, also known as the body mass index. What you do is you take a patient's weight and height and you incorporate that into a calculator to develop a BMI number. Anything that's 25 or greater is considered overweight. But if there's a BMI of 30, that's considered obese. Anything 30 or more is considered obesity. BMIs of less than 18.5 are considered underweight. Data shows a complex relationship between weight status and diabetes. And although the data can't prove that obesity causes diabetes development later in life, there is a correlation between people who are overweight and obese and developed diabetes later. To make things even more complicated, some diabetes medications can lead to weight gain. Insulin, on average, can lead to at least 14 pounds of weight gain over the course of 10 years, but most of that gain in weight occurred in the first year. Now, metformin has not been shown to lead to weight gain and has fewer side effects, so that's why physicians often use that as a first-line drug for diabetes management. But on the other hand, there are diabetic medications that have been associated with very significant weight loss. These are called your glucagon-like peptide 1 agonists, also known as GLPs, and they've been used successfully in maintaining weight loss. Examples include semaglutide and liraglutide. Now, not everyone's going to be a candidate for these drugs, and this needs to be described and discussed by your provider. Weight reduction without the use of medications can actually lead to an improvement in blood sugars. Similar improvements have been noted in blood pressures as well. Now, you can achieve weight reduction with a medical nutritional tailored plan, often guided by the help of a dietitian. They will take your personal lifestyle, your history, and personal factors to help tailor a medical nutritional treatment plan to help you sustain weight loss. Before medicines, we will always recommend lifestyle changes and exercise. Okay? The American Diabetes Association recommends that adults at risk for developing diabetes exercise 150 minutes of fast, moderate-paced activity per week. So that's around 30 minutes, 5 days a week. Now, there's also evidence to show that reducing caloric intake per day can also lead to a delay and postpone diabetes development. The data is mixed on intermittent fasting, as people often overeat between fasts. So in short, if you're overweight or obese, you have an increased risk of developing diabetes. That risk incorporates your lifestyle, your personal history and family history, and your daily personal factors. Think about the daily steps you can take today to lead to incremental change. There is no excuse to delay exercise and make wise eating choices to lead to a better future.